Hello, everyone, and welcome to today's industry webinar, Remote Working Considerations, Risks, and Opportunities. My name is Ellen Knowles. I am the Marketing Communications Manager here at Azalea Health, and I will serve as your moderator for today's presentation. Before we get started, I'd like to go over a few items so you know how to participate in today's event. Everyone on this call is listening in using their computer audio system by default, but if you prefer to join over the phone, just select telephone in the audio pane on the right-hand side of your screen, and the dial-in information will be displayed there. You will have the opportunity to submit questions by typing into the questions pane on your attendee control panel. You may send in your questions at any time. We will collect them and address them during the Q&A session at the end. I would now like to introduce our presenter today. We have Barry Heron of Heron Health Law. Barry has more than 30 years of legal experience, and he has devoted the majority of that time serving healthcare providers from single physician practices to multi-provider systems. And with that, I'll go ahead and turn it over to Barry to get us started.
Thanks, Ellen. I hope everybody's doing okay. Wiggle your mouse and wave from internet land. There you are. Good job. So we're going to talk about this remote working, and we'll jump right into it. So the first thing we're going to talk about is just the items that we'll talk about today. Can I make my employees come back to work? Can I make employees get tested? What policies should I have in place if I permit remote working? What new risks should I consider in permitting remote working? And the last question, which I'll answer first, is it okay if I'm tired of everyone talking about the new normal? Yes, it is okay for you to be tired of people talking about the new normal, because it's not normal. It's different, but it's not really different. It's just different in the way that we're having to automate and perform certain tasks. So that's what I want to impress on you as we talk about the legal stuff, is we may be using our grandchildren's technology to accomplish these tasks, but we're doing it within the confines of our grandparents' legal system. So the law isn't appreciably different. Here are some general rules you need to think about. Unless an employee has a mental health disorder that a provider says is going to be exacerbated by a return to work in an uncertain environment, or they have some other condition that's considered a disability under the Americans with Disabilities Act, that exposure to COVID would aggravate in a harmful manner. Assuming one of those two things is true, and your business is one that's subject to the requirements of the Americans with Disabilities Act, and furthermore, you generally do not permit remote work, then you can make people come back to work. So notice how all that comes together. The employees have to come back to work if you don't permit remote working in their job description anymore. You can make them come back to work unless they have some kind of actual disability that is recognized by the ADA that would let them work from home, and your business is subject to the requirements of the ADA, and they do a job that they can do remotely. So that's the first thing. The general rule is, when you open back up for work, you tell people it's time to come back to work. If they don't come back to work, that has consequences. Second of all, pregnancy in most states is not an excuse not to come to work for fear of COVID. There are only certain states that have specific protections other than the Pregnancy Discrimination Act, which is a federal act, and that doesn't apply here. If you're in Massachusetts, New York, or California, there are some rules around pregnant people in the workplace and those kinds of things, and you need to look at those specific rules. But for the rest of us, there's nothing that would say pregnant people get a pass and don't have to come to work because they're afraid of COVID. You do have to follow the guidelines that are put out by the Occupational Safety and Health Administration for safe workplaces. That's where the enforcement hammer really drops. The CDC guidelines for COVID control are not rules. They're not regulations. They don't have the force of law. They're just guidelines. And so you can make your own decisions. In some states, following the CDC guidelines or the staged opening criteria have been clothed with power to prevent you from being sued if you follow those guidelines and you open up. So if you're in one of those states, you need to follow those rules. But in general terms, what we're talking about is the safe workplace rules for OSHA. That's what's driving how we all come back to work in a COVID world. Because you have an obligation to keep your workplace safe for the other people that work there, you can make your employees get temperature checks, wear PPE, make people get a positive or negative COVID virus test, not an antibody test. The Equal Employment Opportunity Commission has said just having the antibodies in your system is not enough to exclude somebody from the workplace and make them take time off. They have to have an active infection, which is a positive virus test. Okay. In fact, we want everybody to have antibodies so that we can get behind this thing, as sooner than we can. So this is the important takeaway for that. What's driving your reopening in your practice and not doing remote work is the obligation to maintain a safe workplace for other workers. And that's what you have to do. So when you do that, if you have somebody that's symptomatic, you can send them home until they have a test that shows that they are negative for COVID. And if they're not a salaried employee and you send them home and they don't have any paid time off, they lose pay. And that's okay too. There's a lot of misunderstandings about this particular kind of thing. And we used to call it in the legal business, we called it presenteeism instead of absenteeism, where people are grossly sick and they come to work. Well, we can't afford to do that much anymore, and particularly with COVID. So you can make people not come to work. And if they do come to work, you can send them home. And if they don't have any paid time off, you can dock their pay if they're an hourly employee. If they're a salaried employee, you still have to pay them. That's a subject for another time. So let's set the clock forward a little bit once we have a vaccine that's developed. You can require your employees to have a vaccine and in order to work at your place. If you require it as a rule of the workplace, then you have to pay for it. But everybody's going to want to get this vaccine. If you require people to have the vaccine in order to come back to work, and they have a religious or some other legally recognized exemption, then they can come back to work without the vaccine, but you can require them to have a negative COVID test, particularly during COVID season or flu season. If they start to be symptomatic, you send them home just like you would anybody else. And so that's what you can do. The next bullet is very important because we're having some dialogue about that right now in the media and other places. If schools do not reopen in your area and your office is open and you require people to work from your office instead of from home, and the person says, well, I can't work in the office because I don't have any childcare, that's not your problem. That is not your problem now. It's never been your problem before. People have just got to figure it out. So you don't have to pay for childcare. You don't have to permit remote work because of childcare concerns. If that person has a job that they have to do physically in your office and you're not remote working for a variety of reasons, and that person's kids are not in school or they're doing school remotely and they don't have a childcare solution, that's not your problem to solve. That's very important to understand. Last two things on general rules. It's possible that your workers' compensation insurer might have to pay for COVID treatment, but probably not. The reason that is so is because you're not going to be able to tell as an employer, and your employee is not going to be able to tell as an employee where they got the virus. If you screen all your patients and if you screen all your staff and somebody is asymptomatic and they get the virus, it's just as likely that that person that works for you got that virus because they went to a restaurant or they went to a park or they stood in line with somebody that was asymptomatic. It's a question of proof at that circumstance. It does not follow that because you work in healthcare and you had to come to work and you showed up symptomatically with COVID that you got COVID at work. It's not at all clear that that's the result. There are two states that we know of as of today, Kentucky and Illinois, that have rules that would allow workers' compensation coverage for treatment of COVID symptoms if you are a person working in an essential business, whatever that's defined as in those states. And there are other states that have rules for first responders and healthcare workers about getting sick on the job and who gets to pay for that treatment. But in the main, a lawsuit or workers' compensation claims for workplace injury and medical care as a result of COVID, the question is going to be one of proof. How does the employee know that they got that virus at work? Because you require people to come back. The defense, of course, is what we just talked about. But we did everything that the CDC said we were supposed to do. We followed the staging criteria of our State Department of Public Health. Everybody's temperature checked. Everybody wears PPE. We do social distancing. We close our cafeteria, et cetera, et cetera. So that's the issue. So that's where we are. Finally, just because you're really worried about getting COVID and you have to take public transportation into work does not give you an excuse not to come to work. You've all probably seen the news articles about the increasing demand for good quality used cars because people have decided not to do public transit and decided not to do buses and those kinds of things, and they're driving themselves to work if they have to go to work because they don't want to get sick. So that's the general rules for how the workplace kind of goes. All right. Now let's talk about some specific considerations that involve remote work. The first big one is HIPAA, of course. Just because you work in an environment that's different from the environment that you used to work in before you started working remotely doesn't mean that you get a pass on HIPAA compliance. In fact, working remotely creates additional risks of HIPAA compliance because you don't control the physical environment of work in the way that you used to. So you still have physical security considerations of the work. You still have the problems of sending the information to and from the place that the information is being processed. Remember, HIPAA requires that the data that's being moved has integrity and confidentiality both in transit and at rest. And so if you're working inside the enterprise and you're moving data back and forth, that data in transit has issues. It's one of the advantages of having a software as a service application if you use any of those, because the data never actually sits on your desktop. You may be typing it in, but you're typing it into a secure web portal, and then the data goes into the data center, and it's never actually living in your computer. So processing that kind of data in that kind of environment is probably better, because if you have the right business associate agreement and your provisions with your contractors are right, you've shifted some of the reliability issues for confidentiality, integrity, and accessibility to the vendor. And they've agreed to accept that in exchange for you paying them a fee. And so HIPAA in a remote working environment may actually be easier to comply with if you're using a software as a service platform than it would be if you're trying to distribute data amongst a bunch of people's personal technology in places that you can't control. However, you still have to have a physically secure environment for any PHI that's not living in the cloud or living in the computer. So just because you have multiple workplaces now, because people are working from home, that home workplace is still governed by the physical security rules and privacy rules of HIPAA. So it just makes your compliance task harder, because now you're policing 10 locations instead of 1, or 50 locations instead of 3. So don't forget about HIPAA. There are some disturbing statistics about how this works, is that 61% of data breach victims were companies with less than 1,000 employees in 2017. 65% of companies have over 500 employees who have never changed their password. And when we say never change their password, that means keeping the same root password and just changing the numbers or the special characters at the end. So if your original password was football and you changed it to capital F football, and then you changed it to capital F football 123 or capital F football 123 exclamation point, that's really not changing your password. It's fooling your computer system into thinking that you've changed your password, but your password's still the same. And that's important to understand, because the iterative engines that the bad guys run on passwords will try all of those things, and they'll figure it out. So it's the whole password concept that needs to be different, not just appending different letters and characters and things to the root password to fool your password screening devices. So you've got to do a better job of that, small people. Then 95% of data breaches have cause attributed to human error. Yep, that guy is the cause of most of this problem. What's even more disturbing is that more than 50% of these security incidents are caused by somebody who's done the same thing wrong more than once after they've been caught by their employer doing the wrong thing. So they continue to make those same mistakes. Either they do it willfully or they just can't be trained. And that's a totally different presentation for another day. But in the remote working environment, you have to look at your workforce and the places where your workforce does work as threat vectors. They really do expand the battle surface for the bad guys to come after you. And if you don't believe me, why don't you just believe what the FBI says and the Internet Crime Complaint Center, because they figured this out already. The FBI anticipates cyber actors will exploit increased use of virtual environments by government agencies, the private sector, private organizations, and individuals. It's the truth. Here's a great example. You remember these guys? Remember the porosity of Zoom and people sort of squatting in Zoom rooms or getting in, and how difficult it was for Zoom to create a password or multi-factor authentication issue, right? We still have that issue. We're using GoToWebinar here. In order to get in, you've got to give an ID. You've got to have a unique link that you click on that's only for you. It can't be forwarded, right? So we're doing that multi-layered thing here. But we've also seen how people have done colossally stupid things on Zoom. Like you'll do a Zoom room and somebody will be Zooming from their internet technology suite, and behind them there's the password of the day to get into the information technology suite. There's a particularly famous photo of something that happened during the Olympics where they were taking a shot of somebody who was doing commentary from one of the vans, the Olympic production vans, and behind them was the password, the website and password to get into the information technology suite for the Olympics for that broadcaster, and you could read it over the person's shoulder because they had printed it in really big letters and just stuck it on the wall. And the camera picked it up, and people did screen captures and shared that all over the place and said, this is great, now we can hack into the Olympics. So we have to be careful about the technology that we're using when we work remotely. And this has got nothing to do with the etiquette of not wearing footy PJs or bunny slippers or just wearing a shirt and tie and then, pajamas from the waist down. It's none of that stuff. It's about hardening the technology that you use to make sure that things don't have problems with. I had a client yesterday that said he started a Zoom meeting on his phone. And he just finished doing some exercise or whatever it was. And then when he came into the house and he switched to his desktop, he forgot that his desktop automatically enabled the camera when he was doing Zoom meetings. And so he's sitting there in front of his computer, all sweaty and gross, drinking out of a water bottle and whatever. And this is a business meeting. So technology can be helpful, but sometimes it creates problems for us. And we just have to watch out for those kinds of things, right? The next thing that you already have in place is cybersecurity insurance. And everybody should have some. And if you don't have some, they'll get you some. But cybersecurity insurance sometimes has different types of limitations on coverage and exclusions based on what you tell people about how you work. So I'll just give you an example. My cybersecurity insurance policy specifically requires me to tell them what type of security software I mandate for everybody in my law firm. Since we all work remotely in my law firm, I have to have a standard security suite that's acceptable to my insurance company to provide virus threat mitigation and those kinds of things. And they want to know what my software platform is and where we store data and how we share information. And I have to put that all in my application for coverage. And so if you're now letting people work from home and you've already answered all these questions and you haven't thought about how you do remote work, you probably need to go back and look at your cybersecurity insurance policy and the application for that policy and what you said about your work environment and what the risks were, so that you know whether you have coverage in case something goes wrong. But that's something that we should be doing already. Anytime your ecosystem changes with regard to what technology that you're using, what software you're using, what software as a service you're using, you need to be going back and either with your broker or your lawyer, or preferably with your broker and your lawyer, looking at your cybersecurity insurance policy to make sure that your new ecosystem is covered and that the risks that you're assuming by using that change in your technology platform don't fall into an exclusion or an uninsured pathway. Very important to do that basic piece of housekeeping. Remember, Hipaa requires that you do a security risk assessment anytime you change your PHI and ePHI ecosystem, right? Well, part of your risk assessment ought to be, how do I lay that risk off on my insurance company when I change my ecosystem? So if you're not doing it to be HIPAA compliant, you really should be doing it to make sure that you have insurance coverage, because a lot of people create what they call a moral hazard. And a moral hazard is when you think you don't have to pay for anything, you start getting lax and sloppy. If it's not your job to clean up the break room, you leave stuff laying around the break room, right? If you don't think you have to pay for cybersecurity mistakes, you're not as cautious. And so that moral hazard has come back now to bite us, right? Because we've changed our workplace, but we haven't reevaluated our ecosystem of technology risk and how we lay that risk off on our insurers. And so these are things that people should be doing all the time. They're just more pronounced now. So that's the last of kind of the present sense things that you should already be doing, that you should need to be thinking about when you go to a remote working environment. Now we're going to talk about some specific things that you probably need to have in your policies that govern how you do remote work. And this is not just for COVID. This is for distributing workplaces around the world where you don't require people to bring their lunchbox and come into the factory and sit at their workbench and make things. So these are policy recommendations that you need to consider if you let anybody do remote work, and it doesn't matter how they do it. The first one is they need to have secure routers. Most people do not do a very good job with endpoint security. That's what this is. This is the endpoint that somebody attaches to the system. So there's the internet. The internet connects your workplace with your employee's home. Your employee's home now has this router. And if they're not plugging into a hard wire into their cable modem, which hardly anybody does anymore, they're using one of these routers. And so you need to have security applied to this router. You need to make sure that it's password protected, that it updates its hardware and software for all the latest security stuff, that you've disabled all the factory conventions that people can go on the dark web and look up by serial number. They can figure this stuff out. They can try those kind of security conventions. You need to disable all those things. And then this router is hardened in that way. It has no default security settings that allow a backdoor. It now has passwords that are controlled and changed regularly. And so that's the kind of thing that we're talking about. Your policies should say how you do that and when you're supposed to do that, and that it is required as a condition of doing remote work. That needs to be in your policy. The next thing in your policy needs to be, you need to have a firewall. This is what we mentioned earlier about the cybersecurity insurers requiring some type of embedded security software on remote working terminals. You need to have that policy. Your policy needs to be at least as strong as what your cybersecurity insurer says you have to have. But you need to dictate the kinds of security that people have. You can do that. Your technology people need to tell you what the best thing is. You can even say what the settings need to be. And as long as you tell people that and that you have the right to audit that, you can make them have that type of technology available when they tap into your system. but you need to have a policy that says you cannot work on a system unless you have this safety and security software installed of a type that we have approved. Just that clear. Just that clear. You also can say where you can work, right? And that's important. And where you can work has a lot to do with how you recognize that person's computer. You can make them use a virtual private network. You can make them use multi-factor authentication. Multi-factor authentication is really the best of all of that kind of thing if you can get it to work for you. But you want to know that the person that's tapping into your data is that person, right? So what we now have is we have a secure way of getting into the system, right? Security on the endpoint. We then have software that's installed that prevents people that access our system from putting stuff on our system, malware, that we can push through the endpoint as unknowing, unwitting rubes, okay? The third thing is, before the system lets you attach, you need to be able to verify that that's the person that it is supposed to be. This multi-factor authentication, this trusted device authentication. Whatever it is that you use, you need to be able to minimize the number of people that can just log in to your system, right? If people are on leave or people have been fired, you need to deactivate their credentials so that somebody can't luck up on them in the internet, right? If their credentials are their email address and some password, it's hard sometimes to disable somebody's email, particularly in an environment where you want to continue to monitor that person's email box, make sure you haven't missed any business opportunities. But that email address being live, if you leave that live and you don't take down their password, you don't change their access criteria, you leave yourself open to threat. So this multi-layered, multi-factor authentication, technology authentication, human being authentication, it's very important to have policies around that. You also need to have policies about record filing, storage, safety, security. Okay, Hipaa has both a data security element in the security rule and a physical security element, which is the privacy rule. For facilities that separate the privacy and security oversight, physical security of PHI is the privacy official's domain. So when you're working remotely, you have to worry about how things are stored. You have to have secure storage. Your laptops or the technology that you issue to your employees has to have security protocols on it so that nobody can access that data to get into the computer. Never mind getting into your system, right? Because if you use a trusted device type of authentication, then getting into the computer defeats a lot of that security. So that has got to be secure. Then the things that the person takes home with them have to be secure. If you're going to allow people to download data onto their computers, you need to have all of that data encrypted. You need to be able to lock and wipe and kill that device remotely in order to provide that level of security that you have, so that because you're not controlling the workplace anymore. You can't just lock the building and say we're all secure unless somebody breaks in. You've got to have physical security at all the places where people are working remotely. This is new for a lot of people. So you need to think about that. Then you need to think about storage. Now, this is my favorite Dilbert cartoon, where he goes to the storage manager and says, these valuable documents should be stored for 5 years. The guy walks right over to the trash can and says, my job got easier when I realized nobody ever asked for anything back. Well, if he just throws it away, then you haven't securely destroyed that data, that PHI, right? So you have to observe the storage requirements, but you also have to observe the proper destruction requirements too. And that means destroying data in a way that it cannot be reintegrated, put back together again. You know, you've seen all the spy movies about people rooting through trash and taping shredded documents together. Yeah, well, you know, that's a real concern. And so that strip kind of shredding doesn't comply with HIPAA anymore. You know, the cross-cut shredding and all that kind of stuff, that's what you got to do. Or you turn it into pulp, or whatever it is, right? Or you get somebody to do that for you. So the question is, if you have people working remotely and they're generating paper that has PHI on it, you've got to have rules about how they get rid of that paper. Do you give them a shredder? Do you require them to buy a shredder? What do you do? So that's an important consideration. If you had a big blue dumpster with a lock on it at your workplace, and that was your solution to the security of documents that needed to be destroyed, how do you manage that in your remote environment? Big question, right? This is the cone of silence for people that remember the Get Smart TV show or the movies with Steve Carell. This is the actual cone of silence that they used in the original TV show. I put this up here to explain to you how you're supposed to have telephonic communications in a world where you don't control the physical environment. At work, in a law firm, when you have client conversations, you're supposed to close your door so that people that are walking by can't hear attorney-client communications, right? If you're working on stuff and you're using PHI and you're doing it from home and your kids and other people can hear it, or your guests or your cleaning lady or whoever it is can hear your conversations, that's not secure. And unless you have a business associate agreement with those people, then you have problems, right? Your children are not your employees, unless they are. But in most cases, they aren't. And they're not entitled to know all of this stuff. And so when you have conversations at home or other places, you have to be careful about what you say. And that means you have to think about having those conversations in a virtual cone of silence. And you need to have policies about that. Your policy needs to say you need to have an environment when you work from home that is free from interruption and that does not allow people who are in your home to overhear conversations about work. It's just that simple. And if a person can't accomplish those tasks, they don't have a suitable work environment, you can let them go because they can't work remotely. And if they can't come to work, then there's really nothing they can do. So that's important to remember as well. You can have a policy that says you cannot use the internet to do anything other than access our technology. This is important for environments where you're using trusted device technology to access software as a service or to dial into a web device or a system that is maintained by the employer. And you can say, you cannot use the internet, you cannot access the internet, you can't browse the internet from this device. You can't use it to check your personal emails, you can't use it to find out what cat pictures have been posted to Facebook or wherever it is. We're not Instagramming, we're not doing any of that stuff from this computer that I gave you to do work, because there are risks associated with attaching documents, looking at things, all that kind of stuff. You can have such a policy, particularly if you have technology that you've provided to your employees. You can say, if you want to browse the internet, use your phone. Do not use this technology that I'm giving you to do work. Lots and lots and lots of porosity in work environments where people have access to the internet, unfettered access to the internet and sites, and they get into trouble with those kinds of things. So if you can have such a policy, we would recommend you have such a policy. The next policy you need to have is you cannot download anything onto these computer systems that we give you for work. People will want to put applications on their computer. They may want to download games that are created by people in China or Russia that have malware installed in them that will spy on your computer. They may want to load their personal tax software or do their taxes while they're at home because they don't think that you know that you're doing that. But you can absolutely lock down the technology that you provide to them and say you cannot download any technology onto these platforms. Our IT department will put what you need on it, or it will give you a code to download that. You cannot download anything to these computers other than what we tell you that you can. That's very important. It prevents malware from being introduced. It might violate certain intellectual property covenants that your employees don't know about using open source software of a certain type with custom designed computer applications. It also may cause things not to work correctly. If you have conflicting security protocols by multiple security software, for example, it might screw something up and either you not get technology that you're supposed to get, or it allows technology to get through that you don't want to get through. So whatever policies you have in the remote workforce, you need to have this one, which is you cannot change the ecosystem from which the person works without the permission of the IT department. And you should probably have that at work too. You wouldn't let somebody in a physical work environment download software onto a computer without the IT group's permission. You can't have that policy for a remote work environment as well. You need to have a policy that says we don't pirate software. You cannot do anything with software that will cause violation of anybody's intellectual property rights. You cannot change the software that you use. You cannot do workarounds. You can't put something on top of it that we don't approve. We're not going to allow you to use pirated copies of software. My favorite cartoon on this was one that says, hey, we just got some really great ethics and compliance software at work. And the person that's sitting at the coffee table with the first person says, gee, I'd sure like to have some of that where I work. And the first person says, well, I'll just burn a copy and email it to you. So we can't have that kind of thing going on. Most software agreements now have representations and warranties that you will not allow your ecosystem to do anything that would knowingly or negligently create a violation of the intellectual property rights of third parties. And so you need to make sure that you have that policy. And if you're going to distribute work to remote locations, you need to make sure that people have that understanding that work computers are for work. They use the software that's supplied by the workplace, and you don't do anything to the software other than what we let you do with it, including downloading other software to the platform. You have to have physical security also. Physical security, very, very, very important. If you lose your laptop and it's got data on it, you're just asking the government to bill you $125,000 for not having an appropriate security solution. There are tons and tons of cases out there where the government just starts fining people for having laptops stolen or portable hard drives stolen. So physical security is a HIPAA privacy concern. Do not let people take their laptops from their workplace unless they are coming to work. This is the argument in favor of making people use your own technology, right? The kids can't play games. They can't do distance learning. They can't watch Netflix, none of that stuff. You control the physicality of that computer system all the time. Nobody else gets to use it. It's just like it was locked up in your office at work. And you need to have those policies because that is the low-hanging fruit for the federal regulators. They will pound on you if something happens to that technology. In that technology rule, you can also tell people that they're not allowed to attach thumb drives, external drives, any of that kind of stuff. In fact, there are companies that make little plastic plugs that you can hammer into the port so that you can't stick something in there. And we know a lot of people that are using that solution, particularly the people that contract with the government and have really strict Department of Defense or other government agency rules about using portable data. You know, if you need to burn something onto a disk or whatever it is, have somebody in your enterprise do that in a controlled environment. Don't delegate that permission to other people in your distributed workforce. Just don't let them do it, period, full stop. Their policies need to say that. The policy needs to let you discipline people if they break that rule. Remember, policy provisions are not suggestions or guidelines. They are mandates that you impose to permit people to work other than in your physical space. You need to remind people that all the privacy and security policies and requirements apply regardless of where people work. And violating these policies can result in termination of employment regardless of where people work. You need to remember those things. And you need to impress those on people when you send them out into the remote workforce so that you mitigate your risk from them doing the wrong thing. All right, so that's all the stuff you should be doing. Now let's talk about specifically some new things that have come along since we all started engineering our technology environments and issues that we have with people working from home. This is Alexa. Alexa always listens to what you're saying. People use lots of different voice-activated controls these days, but homes that have Alexa or Google or any of those things, any of those listening systems that stay on all the time, that's a problem for environments that use PHI. There are lots of articles out there where people talk about using virtual scribes. When it's a virtual scribe, all that means is that there's a device with a microphone that connects the room that you're sitting in with your doctor to somebody in India. and that person just types everything that's said in the room. Doctors have to get permission to use a scribe in that environment with patients, and if they don't, that's a HIPAA violation. But you can create your very own HIPAA violation with tools you have at home if you have an Alexa-enabled environment, and Alexa listens to you talking about work all the time. So you have to say in your policy for risk for remote working, you must disable any voice-activated software controls in the environment where you are working so that somebody's not snooping on your discussions all the time. That's just a new thing. We have to think about that. And just because you're not doing it in the workplace doesn't mean it's not a problem. If you're a business that lets people work from lots of different locations because you're a national business or you have clients all over the place or you have whatever it is, you have to understand the crazy quilt of state rules. Every state's not the same. HIPAA is the floor, not a ceiling. States that have more stringent privacy protections, more stringent security rules, like California, like Georgia, which has a constitutional right to medical privacy, other places that have these rules in place, you have to know what those rules are. You need to understand that the person that's working remotely in that location, even though your business has a legal location in one place, that person may have a different privacy obligation, and you may have a different privacy obligation by facilitating somebody working from that place. And you need to understand what those rules are and how those affect how you distribute work to new places. Remember, remote work is doing work from a place other than your regular workplace. It is not virtual work. It's distributed work. And that person is working from a physical location. That person might need a business license depending on what jurisdiction you live in. If that's where they're regularly doing work for you as an employee, they might need a business license, or you might need to get them a business license, which leads to this last slide. If you've told somebody that their regular workplace is their work, how do you make them do their work? If there are people that need printers and they need postage and they need to go to the Federal Express place or the post office or whatever it is, how do you get them their supplies? Do they buy those supplies with a company credit card? Do they buy them with their own credit card and then submit a reimbursement? If they have to go out and get them and they get into a car wreck, are you on the hook for that car wreck? Because they're doing something for you under the rules that you established for them. If they're injured, does your workers' compensation carrier have to pay for it? How does that work? We know people that do remote work and they ship all the supplies that a person needs to them by FedEx. So they don't have to go out and get things. They don't have to get letterhead. They don't have to get magnetic media. They don't have to get any of those things. Don't go buy it. You send us an email and we send it to you from Central Supply. Because they do not want an employee doing business in the employee's car during work hours that can make their liability window go higher. So you have to think about that also. You have to think about, now that you're working from different places, it's not virtual working, it's remote workplace environment control. That's the biggest mindset change you have to undergo. Are you really working from lots of different locations? If you are doing that kind of work, what rules apply in that environment? Does the rule that talks about business licenses apply? Does workers' compensation apply? Does vehicle liability apply? Those things you have to evaluate. You need to sit down and talk about them with your broker, with your lawyer, ideally with your broker and your lawyer, to make sure that when you let people work from home, when you mandate that they work from home, not as a convenience to them because they're sick or whatever it is, but you told them to work remotely because they can't come to work. Now what? And so that doesn't really answer a lot of questions. It creates more opportunities for risk, but it's the kind of dialogue you need to have. And ultimately, reopening the workplace eliminates a lot of that risk. However, there are lots of businesses that have decided we don't need to have a big box for people to sit in, and we're not going to pay for that anymore. So now we're going to expect people to work from home. So if you're a company that says, we'll buy $500 worth of furniture for you to set up a home office, and we'll pay for an internet connection for your home office, you've basically told that person, that home office is my business location. And so now what risks does that person have for something that happens at that business location? Or what happens when that person's driving to do things for that business location and that work? Most people aren't talking about that. Most people aren't thinking about that. That's the kind of stuff we need to be talking about and thinking about. And that's the reason for us having our time together. So that's a lot of information to digest in a very short period of time. I'm going to put my contact information up here. And then at this point, we are ready to take questions from anybody that's got any questions.
Thank you, Barry. Yes, so as Barry just mentioned, we are going to open up our Q&A session. So you can go ahead and submit your questions now if you haven't already done so. That is located in your attendee control panel. So please take a moment and do that. And while we are waiting for some questions to be submitted, Barry, I want to just pass it back to you really quick and see what is the most common question that you get that's related to remote working?
Oh, the big question is, can I make people come back to work? I mean, by far, that is the question that everybody wants to know. When can I make people come back to work? I think it really hurts people's heads to think about, like I said, nobody wants to think about the new normal. They want to get back to the old normal. And so that question is, what are the issues about making people come back to work? And we have people that don't want to come to work. Just the other day, I had a client that said, one of the doctors that works there, his wife is pregnant and he doesn't want to come to work because he doesn't want her to get COVID. And we said, well, doc, the way you prevent that from happening is what Chris Cuomo did, is you live in the basement, you get a test, you make sure you don't have the virus, you use PPE. How do you keep your wife from getting anything at the workplace? How do you keep her from catching diseases that any patient has? How about do that? But we're not going to keep paying you if you don't come and start doing procedures on people. We're just going to let you go. So that's the biggest issue, particularly in healthcare where you're procedurally driven, right? If there are people that have to come to work to do procedures, and then there are people that need to document that work and people that need to bill for and collect for that work, that's driving the train. How do we get back to that? That's the big set of questions by far. How do we get back to what we were doing before without creating new risks for us?
Thank you. And then as far as, HIPAA compliance that you talked about throughout the presentation when using Zoom or other non-compliant technologies, what advice do you give practices or other facilities that are utilizing those non-compliant platforms right now?
Well, it's really hard to do telework unless you've got a designated teleworking environment where you've got end-to-end security. The problem with telemedicine right now is that unless you're doing real telemedicine with a telemedicine link that has all the baked-in security, what you're really doing is you're FaceTiming your patients. I would actively consider, if it were me, using FaceTime, because FaceTime uses the encryption on your phone, which is the hardest thing to de-encrypt. Telephone conversations that take place over the FM bands that we use for telephone transmissions on our little computers that we call phones are the most secure conversations that we can have in our information technology environment. And if FaceTime uses that same pathway, I would do that if you have to look at somebody. But let's face it, a lot of diagnostic medicine, you just can't take a picture and text it to your doctor and ask them if this is cancer. Telemedicine is great for maintaining patient relationships. It's great for continuing patient relationships. It's dreadful for starting patient relationships because you may not be able to do an adequate history and physical or firmly assess the person's condition and work up your problem list and all the things that you have to do. You can't draw any blood work. You can't take any pictures. How do you do a new patient visit with telemedicine? That's just very, very hard. And so I think in our rush to try to create an environment where we can bill for telephone calls or bill for FaceTime meetings or whatever we're calling telemedicine, to get around this as a temporary workaround, we may yet be able to continue to bill for telemedicine, but the pass that we've gotten from the enforcement people on telemedicine compliance with HIPAA and other security protocols, I think that's going to go away. And so now we've got to think about it differently, right? That may mean we need to use real telemedicine solutions that have end-to-end security. It may require patients logging into a portal, having a password using multi-factor authentication, exchanging data through a secure portal, or it may be something else. But what we know is not going to be the case is using a porous technology that doesn't have end-to-end encryption or security and using that to exchange PHI. We know that can't work. People have tried that before. Now that they've been exposed doing that, not to pick a bad choice of words, I think that's going to have to change. Whether you get paid for doing telemedicine in the future, that's a different issue. Whether you can create a private and secure environment to have a discussion with a physician, that's going to be the compliance check. And then the third thing you have to think about is aligning all of this with the rules about prescription drugs. How are you going to be able to do prescription drugs for new patients when you can't do a history and physical, where you can't take blood work, or how are you going to renew prescriptions for patients where you have to have blood work done and they can't get the blood work done because they can't come to your office? You know, those are the kinds of things we've got to solve for if we're going to do remote practice of medicine. Never mind just doing remote work for healthcare providers.
Thank you. Well, it doesn't look like we have any additional questions at this time. I think that you covered everything very clearly, so thank you for presenting today. I do want to remind everyone that today's slides will be shared in a follow-up email, which will also include a link to the webinar recording, so you can review that again, or you can share with any of your peers. So we will go ahead and conclude today's webinar. I do want to know
Ellen,
if you, yes.
Can I interject one thing? All right.
Yeah.
So if the people that are listening want a head start on a remote working policy, if they will navigate to the heronhealthlaw.com website, and there's a tab on the website called Insight, INSIGHT, and if you search for the remote working article that's there, in there is a link to a draft remote working policy that covers a lot of the stuff that we've talked about today. It is just a way for you to get started on thinking about how to have policies that are updated for the fact that you're now working other than at your primary workplace.
Perfect. Thank you for sharing that. And as Barry mentioned, you know, he has his contact information here, which will also be included in that presentation. So if you have any additional questions, you can reach out to Barry. I'm sure he'd be happy to help and provide some guidance. So I want to thank you all for joining us today. A special thank you to Barry for presenting. And on behalf of Azalea, hope you have a great rest of your day. Thanks. Bye-bye.